Thank you for joining me today. In this video, we are going to go over SSRI medications. SSRI medication, it is anti-depression medication and anti-anxiety medication. Selective serotonin reuptake inhibitor medication are commonly prescribed anti-depression medications. SSRIs are considered the first line pharmacology treatment for many depressive and anxiety disorders. They are generally effective, well tolerated, and safe in overdose than tricycline antidepressant. This is educational only. This video is educational only. Common selective serotonin reuptake inhibitor medications include Pristiq, Zoloft, Lexapro, Celexa, Duloxetine, Luvex or Venlafaxine. Mechanism of action of SSRIs, primarily it inhibits the serotonin transport. It reduces the presynaptic serotonin reuptake. It increases serotonin availability in the synaptic cleft. That produces downstream adaptive changes in the serotonin nucleus circuits. So the serotonin will be more in the nucleus of the cell. Clinical importance is not immediately because therapeutic effect involves gradual neuroadaptation changes. So when the serotonin it increases in the neutral circuits, that create neuroadaptation changes, and that takes 4 weeks to 8 weeks to be effective. Major clinical indication for SSRIs are major depression disorder, persistent depression disorder. For anxiety disorder is general anxiety disorder, panic disorder, social anxiety disorder. Also, SSRIs are used for trauma, stress-related disorders such as PTSD disorders, obsession compulsive, and relative disorders such as OCDs. Other conditions that have been used for SSRIs include premenstrual dysphoria disorder, bulimia nervosa, some eating disorder, and impulsive control disorders. The specific FDA-approved indication vary by the medication to medication because SSRI has different medications. Each medication is approved for different it has different indications. For comparison, SSRI comparison medications, for example, the fluoxetine. Fluoxetine commonly starting dose is 10 milligram to 20 milligram per day, and maximum dose that the patient can have is 80 milligram per day. It has a long half-life and activating. That is the fluoxetine. Sertraline, or other name Zoloft, initial dose is 25 to 50 milligram per day. Maximum dose that the patient can have is 200 milligram a day, and it has a broad psychiatric usage. That means many diagnoses can be used, either if they indicated or over the off-label. Lexapro starting dose is 10 milligram per day, and maximum dose is 20 milligram a day. It's well tolerated. Select other medication such as the Cymbalta and Lufex or Venlafaxine medications. Cymbalta starting dose is 20 milligram and maximum dosage is 20. Starting dose is 20 milligram and maximum dose is 50 milligram a day. Cymbalta maximum dose is the 40 milligram, and the risk factors that has or side effect is that Cymbalta has, it increases the risk of QT prolongation. So you want to screen the patient from cardiac disorders. If they are taking medication that also increase the QT prolongation. You want to assess if the patient have any other serotonic, any other medication that increase the serotonin. Venlafaxine maximum dose, starting dose is 50 milligram and maximum dose is the 300 milligram a day. It has a strong affinity of the OCD. So fluvoxamine is prescribed for OCD disorders. You want to begin prescribing lowest dose, and you want to increase that gradual. Lower maximum dose is applied to the elderly and certain patients because of the QT prolongation that this class of medication has. Dosage should be individualized based on the diagnosis, age, and comorbidity, and drug-to-drug interaction and tolerance. So when you want to consider one of the medications, you want to assess the patient based on their diagnosis, their age, their comorbidity, and if they have other medical conditions, drug-to-drug interaction, and if they tolerated before. Individual SSRI profile for example, Prozac. Prozac has the longest half-life among commonly used SSRIs. Prozac has activating. Prozac has less likely to cause discontinuation symptoms, discontinuation syndrome. Prozac has a strong evidence for depression and OCD disorders. Common side effects of Prozac include insomnia, anxiety disorder, nausea, and sexual dysfunction. Prozac or fluoxetine is long half-life effect can be advantage when misdosed and are commonly and those are commonly. However, it can cause an issue when it's rapidly medication clearance is desired. So Prozac, it is because it has a long half-life and stay in the body longer, if it will be advantage when the patient is not compliant with the medication, when they miss the dosage, so that long effect can help. But if the patient is having a liver damage or kidney issue, if they are elderly, Prozac will stay in the system longer, and that can create and increase the risk adverse effect and side effect. Zoloft has a broader range of the psychiatric indication commonly used for depression and anxiety disorders and frequently selected in a patient with a cardiac risk. So Zoloft has less effect on the cardiac, less side effect on the cardiac, while the Prozac has the risk of QT prolongation. Zoloft commonly used during the pregnancy when a SSRI is indicated. Common side effects of the Zoloft include nausea, diarrhea, sexual dysfunction, insomnia. Zoloft commonly causes GI adverse effect, particularly early in the treatment. Lexapro or escitalopram. It is enantiomer of the cetrobram. Lexapro is generally well tolerated. Lexapro has a low interaction burden, so it has a lower interaction with other medication. Lexapro commonly used for major depression disorder and major general anxiety disorder. Lexapro common adverse effects include nausea, headache, sexual dysfunction, insomnia. Lexapro is often has a particularly first line SSRI when simply and tolerate at priority. So Lexapro is often practical first line SSRIs when a simplicity and tolerability are priority. So it's simple and tolerable. Celexa or citalopram or Celexa. It is effective anti-depression medication and generally well tolerated. Celexa it has dose-dependent QT prolongation interval. You want to use Celexa cautiously in a patient with cardiac disease, a patient with electrolyte imbalance, patients who have congenital lung prolongation syndrome. You want to be cautious using Celexa on other prolonging medications, QT prolongation medications, medication that causes QT prolongation. Celexa has more issue causing QT prolongation and concerns that the most other SSRI medication. Prazosin Paroxetine is effective for anti-depression disorder and severe anxiety disorder. Paroxetine is more sedative than some other SSRI medications. Limitations of paroxetine is anticholinergic effects, weight gain, it causes weight gain. It also causes sexual dysfunction. It causes general discontinuation syndrome. It has a significant drug-to-drug interaction. It also has pregnancy-related concerns. So Paxil or paroxetine, you don't want to use the pregnant mothers. You don't want to prescribe Paroxetine for pregnant mother. Paroxetine is generally less desired in older adults because of the anticholinergic burden. It causes them sedated and fall risk. Nuvaxen Fluvaxamine and Laxor is the other name Laxor. Fluvaxamine is a strong evidence for OCD. So fluvaxamine is prescribed for OCD and availability in immediate release and extended release format. Fluvaxamine or Laxor, it significantly interact with the enzyme P450 drugs that also has that enzyme interact with fluvaxamine medication that has enzyme P450. So enzyme it interact with that medications. Always perform a carefully medication to medication interaction review before you prescribe fluvaxamine. SSRIs, uh, pharmacokinetics differ from between medication to medication, and SSRIs significantly different in half-life and metabolism. So, for example, fluvaxamine, the half-life is 15 to 20 hours, and it has a significant interaction with other medication. Duloxetine, it has a half-life of 21 hours, and it has a discontinuation risks. Cymbalta has 35 hours half-life, approximately 35 hours of half-life, and it has the risk of the QT prolongation. Lexapro half-life is 27 to 32 hours, and it is taken once a day. Zoloft half-life is approximately 26 hours, and it take once a day. For fluoxetine, fluoxetine has a long half-life. Fluoxetine has 2 to 4 days of half-life, and its metabolism is much longer. The longest effect, it has the longest effect elimination from the body. For therapeutic response, early therapeutic response include some patients may initially experience nausea, headache, increased anxiety for the initial treatment. They may experience symptoms of anxiety, headache, nausea, increased insomnia, fatigue. For clinical important, meaningful improvement commonly develop over the 2 to 6 weeks. Fully therapeutic trial may be required for 4 to 8 weeks. So it can fully treatment can be seen for 4 to 8 weeks. So it takes a long time to be effective because it takes neurological adaptation for month or more. For OCD, disorders often require longer time treatment and duration, higher therapeutic dosage, and carefully increasing the dose for the OCDs. Common side effects of the SSRIs include the GI GI symptoms such as nausea, vomiting, diarrhea, abdominal pain, appetite changes. Neurological adverse effects include the headache, tremors, dizziness. It also has sleep disturbances such as insomnia, somnolency. It has also sexual dysfunction. It has also syndrome, serotonin syndrome, because SSRIs increase the serotonin availability, and its serotonin syndrome is life-threatening toxicity of the SSRIs medication that causes by the excessive serotonic activity. Clinical features of the serotonin syndrome include neuromuscular contractions like hyperphalanxia, gluteness, tremors. It has more aromatic, such as sweat or diaphoresis, uh, increased heart rate, increased temperature, increased high blood pressure, agitation, confusion, GI symptoms such as nausea and diarrhea. The high risky combination is medications for SSRIs are SSRIs with the monoamine oxidation inhibitor can cause high risky side effects. If you combine SSRIs with other serotonic antidepressant medication, it can increase the side effects. Tramadol, you don't want to combine SSRIs with tramadol. Letanzol, methadone with SSRIs can increase the side effects. SSRIs with Steve Johnson syndrome, Steve Chan Worth, which is supplement, can increase the SSRIs side effects. SSRIs discontinuation syndrome is more likely with a short half-life medications such as Duloxetine and Venlafaxine. Discontinuation syndrome may include the dizziness, nausea, irritability, insomnia, anxiety, flu-like symptoms, sensory disturbance. Venlafaxine and fluoxetine is the least likely. Fluoxetine is the least likely to cause discontinuation syndrome, while venlafaxine causes the highest discontinuation syndrome. When the medication has a long life, it can cause discontinuation syndrome. Managing SSRIs, you want to gradually taper the SSRIs rather than stopping the medication quicker. SSRIs causes suicidal ideation in children, teenagers and younger adults. You want to monitor SSRI. You want to monitor SSRIs for any suicidal ideation in teens, younger children, and younger adults. You want to monitor increased agitation, irritability, impulsiveness, adapt, adaptive behavior changes when you discontinue any changes. Increase monitor dose, not mean antidepressant should be routinely withheld. Even though the medication has the side effects, you don't have to hold the medication if it's not causing a severe side effects, but you have to monitor, adjust the dose, and switch other medication if that is indicated. Antidepressant medications can cause and precipitate mania and hypermania. Before prescribing SSRIs, you want to screen for bipolar disorder, possible treatment emergency syndrome. Emergency side effects include if you see elevated mood, because SSRI can precipitate and cause mania, hypermania, so you want to assist the mood. You want to assist a decrease for sleep. Those are the symptoms of mania. You want to assist a grandiolous pressure speech, raising thoughts, increase risk-taking activities, because those symptoms are the manic and hypomanic syndrome. You want to avoid antidepressant medications, monotherapy in a bipolar 1 disorder in most circumstances. SSRIs causes low sodium, so you want to assess low sodium symptoms. SSRIs can cause syndrome of inappropriate antidiuretic hormone secretion and low sodium. High risk patient who has a high risk of these symptoms and side effects include the older adult, patient who is taking already diuretics, patient who have previous had a low sodium, patient who have significant medical illness. Symptoms that you want to assess for low sodium: if the patient has a low sodium, the symptoms you want to monitor include headache, nausea, confusion, weakness, and seizure activity. SSRIs can cause bleeding risk. SSRIs can impair the platelet aggregation, so you want to monitor any bleeding risks. There is a medication that can increase the risk of bleeding risks in SSRIs if being taken together. Aspirin, if you take aspirin with SSRIs, the risk of bleeding can increase because both of them impair the platelet aggregation. Both of them impair platelet aggregation, that increase the risk of bleeding. Also, SSRIs, if you combine with NS, if you combine with anticonvulsant medication, NSAID medication, antiplatelet medication, this medication is with the SSRIs can increase the risk of bleeding. Clinical concerns include that you want to evaluate the patient include GI bleeding, uh, easily bruised, nose bleeding. You want to evaluate and assist the medications. Also SSRIs, as we talked about before, it causes sexual dysfunction. You want to manage the dose adjustment. You want to do the dose adjustment. If that's causing a severe effect, you want to switch other antipsychiatric, antidepressant medication. You want to consider medication. You want to lower the dosage. Weight effect vary between medication to medication. In the SSRIs medications and depends on the patient. Generally, fluoxetine often it has a relatively weight neutral initially. Zoloft vary depending on patient to patient. Lexapro possible has a weight gain. Paroxetine has a greater tendency to cause weight gain. Long-term weight gain changes should be monitored. Drug-to-drug interaction of SSRIs include monoamine oxidase inhibitor. Fluoxetine requires a particular long wash period for MOA inhibitor medications. For the enzyme P450 has a consideration because it can interact with SSRI medications such as fluoxetine. Fluoxetine has a strong CYP2D6 inhibitor, so it inhibits the dopamine. It inhibits the dopamine. Paroxetine is also inhibits that enzyme. Fluvaxamine significant inhibit multiple P4050 enzymes. For pregnancy mothers, when an antidepressant medication treatment is indicated, you want to consider a severity of the mother illness. You want to also consider the previous treatment response that the patient had. You want to also consider the risk of relapse after discontinue of the medication. You want to also assess the potential risks for the infant and adaptation symptoms for the infant or the fetus. Other medication specific risks, you want to assess those. Treatment should be individualized rather than stopping automatically because of the patient is pregnant. Lactation. Several SSRIs medication can be used during the breastfeeding when indicated. Zoloft is the most commonly considered a preferable option is because infant exposure through the breast milk is generally low. You want to monitor the infant, you want to monitor the baby for side effects of the SSRIs. You want to monitor if the infant having a sedation, if the infant having a feeding problems, if the infant is irritable, if the infant is having a poor weight gain or growth. For older adults, SSRIs are commonly used in older adults because of they are generally safe. But however, they have a low anticholinergic burden compared to three-cycline antidepressant medications and favorably tolerated for the elderly. However, you want to monitor low sodium, fall risk because SSRIs has a sedation side effect. You want to also monitor bleeding risk. You want to monitor drug-to-drug interaction, GI effect, drug-to-drug interaction. You want to start at low dose for the older adult. You want to start low dose and increase slowly. For children and teenagers, you want to consider risks. SSRIs are used for selected children depression and anxiety disorder. Children with depression and anxiety disorder. You want to also monitor closely for suicidal ideation because SSRIs can increase the suicidal and ideation for children and teenagers. You want to assess the activation and irritability. You want to improve. You want to also assist the improvement or caregiver appropriately. You want to involve with the parents and caregivers. You want to monitor clinical response and functional improvement. For baseline assessment before prescribing SSRIs, you want to confirm the diagnosis because you don't want to prescribe SSRIs patient who has the liver damage, who have a bipolar disorder. So you want to confirm the diagnosis if this diagnosis is depression and anxiety that being indicated for the SSRIs medication. You want to also screen any symptoms of bipolar 1 disorder and mania because this medication increase the mania risks precipitates the mania. You want to assess any suicidal ideation, especially when you initiate the dose and when you want to change the dose. You want to review the current medications because if you add serotonic agency or bleeding anticholinergic, anti-platelet medications, this medication can increase the risk. So you want to review the current medication. You want to review substance usage disorders. You want to assess pregnancy status. You want to consider medication combination and bleeding risk. You want to consider baseline sodium in high-risk patients. For routine lab monitoring, SSRIs generally do not require routine medication level to be monitored. Lab testing should be individualized. You want to consider sodium lab because serotonin SSRIs lower the sodium. You want to monitor the sodium high risk in high risk patient. You want to also test the pregnancy when indicated. EKG for the patient who has cardiac risks. Other lab is based on comorbidity and medication that they are taking with the SSRIs. When you want to switch SSRIs with other medication, you want to review the current medication, half-life, switching strategy depending on the current medication, depending on half-life of the medication, dosage, target medication, risk of the serotonin syndrome, withdrawal syndrome, and risks. Possible strategy include direct switch one medication to other, target and switch, cross tapering, wash period, that is 14 days between the SSRIs and the monoamine oxidase inhibitor. You want to educate the patient and teach them. You want to teach the patient to take the medication consistently as it was prescribed. You want to teach the patient therapeutic benefit, maybe take several weeks. Early GI and sleep-related side effects may be improved. Do not stop the medication quicker. It has to be taper and slow discontinuation. Rapid, you want to educate the patient and teach them to report any symptoms of manic and hypomanic. You want to teach them the symptoms of the serotonin syndrome, and you want to educate them to report that to you. You want to discuss the patient with the new medication and supplement with the prescribed medication. You want to educate the patient to limit and avoid substance usage that may worsen psychiatric symptoms. SSRIs, for summary, SSRIs are generally first-line pharmacotherapy for major depression disorder and many anxiety disorder. Always screen for bipolar 1 disorder before prescribing antidepressant medication. Do not combine SSRIs with monoamine oxidase inhibitor or MOA inhibitor. Duloxetine has the longest half-life and the lowest risk of discontinuation syndrome. Paroxetine has a relatively high discontinuation syndrome burden and greater anticholinergic effects. Lexapro has the greatest concern for dose-related long QT prolongation among commonly used SSRIs. that is a citalopram. Zoloft has a broader psychiatric usage and is commonly selected when the cardiac disorder is when the patient has a cardiac disorder. Lexapro is generally well tolerated and has a relatively low interaction burden. Venlafaxine is particularly useful for OCD but has a substantial interaction potential, drug-to-drug interaction potential. For elderly, you want to monitor SSRI associated low sodium. Sexual dysfunction should be proactively assessed rather than waiting for patient to voluntarily report. Do not interrupt early activation or anxiety. Do not interrupt early activation anxiety as treatment failure. It may improve with time and carefully titration, increasing the dose if the lower dose is not effective. Thank you for joining me today. I would love to see you in my other video, and thank you.